Agoraphobia is an anxiety disorder characterized by a fear of situations where escape might be difficult or help might not be available if panic-like symptoms occur. This fear often leads to avoidance of various places or situations, such as open spaces, crowded areas, or being outside the home alone. Symptoms: 1. Intense fear or anxiety about being in situations where escape might be difficult. 2. Avoidance of situations like public transportation, open spaces, or crowded places. 3. Panic-like symptoms, such as a racing heart, sweating, trembling, or difficulty breathing when faced with a feared situation. 4. Fear of being alone or leaving the house. 5. Dependence on others to accompany the individual in feared situations. Causes: the exact cause of agoraphobia is not well understood, but several factors can contribute to its development. Genetic factors, a family history of anxiety disorders or other mental health conditions may increase the risk of developing agoraphobia. Biological factors, imbalances in neurotransmitters, chemicals in the brain that regulate mood, such as serotonin, norepinephrine, and gamma-aminobutyric acid, GABA, may play a role. Psychological factors. 1. Panic disorder. Many individuals with agoraphobia also have a panic disorder, where they experience sudden and repeated panic attacks. 1. The fear of having another panic attack in a public place may lead to agoraphobia. 2. Stressful life events. Traumatic or stressful events, such as the death of a loved one, divorce, or abuse, can trigger agoraphobia. 3. Personality traits. Individuals who are naturally more anxious, sensitive, or prone to stress may be more susceptible to developing agoraphobia. Environmental factors. Growing up in an environment where anxiety or fear is prevalent can contribute to the development of agoraphobia. Overprotective parenting or witnessing the anxiety of others may also increase the risk. Risk factors. 1. Gender. Agoraphobia is more common in women than in men. 2. Age. It often begins in late adolescence or early adulthood, but it can develop at any age. 3. Other anxiety disorders. Having other anxiety disorders, like social anxiety disorder, can increase the likelihood of developing agoraphobia. 4. Substance abuse. The use of alcohol or drugs to manage anxiety can exacerbate symptoms and contribute to the development of agoraphobia. Treatment. Agoraphobia is treatable, and early intervention can significantly improve outcomes. Treatment typically involves a combination of therapy, medication, and lifestyle changes. Cognitive behavioral therapy, CBT. 1. Exposure therapy. A key component of CBT for agoraphobia, exposure therapy involves gradually and systematically facing the feared situations in a controlled way, helping to reduce the fear over time. 2. Cognitive restructuring. This involves identifying and challenging irrational beliefs or negative thought patterns that contribute to the fear of agoraphobic situations. Medications. 1. Selective serotonin reuptake inhibitors, SSRIs, commonly used antidepressants like fluoxetine, sertraline, or paroxetine can help reduce anxiety symptoms. 2. Benzodiazepines. These anti-anxiety medications, such as clonazepam or lorazepam, may be used for short-term relief but are generally not recommended for long-term use due to the risk of dependence. 3. Beta blockers. Medications like propranolol may be used to manage the physical symptoms of anxiety, such as a racing heart. Lifestyle and self-care. 1. Regular exercise. Physical activity can reduce anxiety and improve mood. 2. Mindfulness and relaxation techniques. Practices such as meditation, deep breathing, and progressive muscle relaxation can help manage anxiety symptoms. 3. Healthy diet. A balanced diet, avoiding excessive caffeine and sugar, can help stabilize mood and energy levels. Support groups. Connecting with others who have similar experiences can provide emotional support and practical advice. Psychoeducation. Learning about agoraphobia and its treatment can empower individuals to manage their symptoms more effectively.